New research is leading the way toward better therapies and improved quality of life for people with chronic conditions like diabetes. Diabetics have long had to prick themselves with needles. Now pumps and pens are available. Dr. Edna Tokayer of Boca Raton Regional Hospital is here to tell us more about some of the new technology available. Thanks so much for joining us. Well, first, tell us, what are insulin pumps and how are they used by diabetic patients?
Well, insulin pumps really just enhance all the different things that we can do to help people with diabetes. So if you're on insulin, an insulin pump will allow you to have better control and more flexibility. You're still getting insulin. It's just a different delivery device.
And how does the pump differ from the simple insulin injections?
Well, when you're giving yourself insulin injections, either by a syringe or an insulin pen, then you're giving yourself injections several times a day. So we call that, multiple daily injections. An insulin pump is something that you wear, and it's a little bit tethered. You're a little bit tethered to you, sort of like my mic. And so what happens is there's a very small catheter that goes from the insulin pump just underneath your skin. It's not really like an IV, but you can sort of think of it that way. So it goes just underneath the skin, and it's constantly giving you a small amount of insulin. And then when you're going to do something that requires a lot more insulin, like eating a meal, whatever time of day that is, you would tell the pump by pushing a few buttons how much insulin you want. So you have to figure out how much you're going to be eating or how much insulin you're going to need for whatever reason, and then you're going to give yourself that insulin by using a button instead of an injection. So, I'm sorry?
No, are there certain diabetic patients that are more apt to take advantage of this type of technology than others? Like, for example, depending on the severity of their diabetes?
Well, the severity doesn't really matter so much. It really matters how open you are to using new technology. Like, I have a cell phone. It can do a million different things, but I just want to make a phone call, But so with an insulin pump, it can do a lot of things, but if you just want to give yourself insulin, it can do that as well. So, it's really for people who want to embrace new technologies. If you're on very, very, very small amounts of insulin, then it may not make sense. Or if you're on very large doses of insulin, it can help, but it can also be cumbersome in that respect.
And what are the primary benefits of the pump?
Well, it gives you a lot of flexibility. If you decide that you're going to skip breakfast, or if you're in athletic training, or if you just, are a busy working person, you have meetings, you have unexpected things that come up, or even if you're, very much a busy mom, where your time isn't really your own. You may not be having breakfast at a certain time of day, lunch at a certain time, dinner at a certain time, snacks at a certain time. So whatever time you are eating, you can give yourself that insulin without going low. So it does give you more control, and it can improve your overall control and gives you a lot more flexibility. So it's really, flexibility is the key.
And I imagine patient feedback has been positive.
The patients who take to it really love it. People are like, I need my pump, don't ever take it away from me. The downside is that it's expensive, and so not every insurance company or patient can see the benefits to that.
Well, thanks so much for joining us today. We really appreciate it. Boca Raton Regional Hospital sponsors our expert and underwrites our Ask the Doctor segment.